In this video, I will be talking about the anatomy and microscopy of thyroid gland. The thyroid gland is a butterfly-shaped endocrine gland in the neck. It makes two hormones that are secreted into the blood, thyroxine T4 and triiodothyronine T3. T3 is the main active form. T4 converts into T3. It regulates the BMR and also plays a role in somatic and psychic growth. Now, first let's see some basic structures related to the anatomical position of the gland. These are some of the main structures forming the larynx. You see the hyoid bone, which is connected to the thyroid cartilage by the thyroid membrane. Posterior to all these three structures is the epiglottis. Inferior to the thyroid cartilage is the cricoid cartilage, to which the thyroid cartilage is attached by the cricoid thyroid membrane. You now see the trachea attached to the cricoid cartilage. Now coming to the thyroid gland. It is a highly vascular brownish red gland located anteriorly in the lower neck, extending from the level of the fifth cervical vertebra down to the first thoracic vertebra. As seen here, the thyroid gland can be H or U-shaped. It weighs around 25 to 30 grams in adults. Interestingly, the thyroid weighs more in females and grows larger during menses and pregnancy. Thyroid is formed by two lateral lobes connected by a median isthmus. Dimensions of each lobe is 4 cm width, 3 cm thickness and 2 cm length, while the isthmus is about 1.25 cm in width, 0.5 cm in thickness and 12 to 15 mm in length. Sometimes the isthmus is absent. Each lobe is 50 to 60 millimeters long and their superior poles diverge laterally on the thyroid cartilage, and as visualized, it overlies the second to fourth tracheal rings. The lobes overlies the fourth, fifth tracheal rings, while the isthmus extends from the 2 to 3rd tracheal ring. Talking about the gross anatomy of the thyroid gland, it has a homogeneous firm consistency. 10% of normal individuals have asymptomatic thyroid nodules too. Let's move on to the inner structure of the thyroid. For better understanding, I have cut one of the lobe to reveal the histological details of the thyroid gland. Here in this wide view is the histology of the thyroid gland. You can make out multiple follicles of more or less uniform sizes, round granular spaces filled up with pink-colored fluid substance. On further closer view, you can visualize each of this pink fluid substance, which is colloid and lined by a layer of cuboidal epithelium. This is a single thyroid follicle, which is the functional unit of the thyroid gland. The thyroid follicles, as shown here, encloses a cavity called follicular cavity. Now in this view, you can clearly see a large thyroid follicle having cavity filled with gel-like colloid and lined by the cuboidal cells called the follicular cells or principal cells. Colloid is made of thyroglobulin, a precursor of thyroid hormone. You can also make out good number of small-sized blood vessels in the thyroid gland, making it a highly vascular organ. The blood supply of the thyroid gland is by the superior and inferior thyroid arteries and sometimes by an additional artery known as thyroidema artery. Now, here we can see the capsule. The thyroid has a capsule which is thin and adheres closely to the gland. Extensions of this capsule within the substance of the gland are fibrous trabeculae. This trabeculae or septa divides the gland into many lobes and lobules. Here in between connective tissues of the thyroid follicles, you will find small C cells, also known as parafollicular cells. They secrete polypeptide hormone known as calcitonin. Calcitonin helps by depositing calcium and phosphate in skeletal and other tissues, leading to hypocalcemia. I am also going to tell you about the nerve supply of thyroid. It is supplied by the external branch of the superior laryngeal nerve and recurrent laryngeal nerve. They are the branches of the vagus nerve. I hope with this video you understand the anatomy of thyroid gland.